Welcome to our 5 on 5. We're pleased to welcome back Ben Bryan, a suicide prevention coordinator for Southern Oregon Rehabilitation Center and Clinics, or as we often know it, the DOM in White City. Bryan, good to see you again, Ben.
Yeah, thank you.
So let's first talk about the suicide problem here in Southern Oregon. How big of a problem is it now?
Yeah, so Jackson and Josephine County have higher suicide rates than average in the state of Oregon. And we know that 2015, we've already seen more suicides than we have in recent years. So it is a big problem.
Okay, and certainly we want people to know that help is available to them.
Yeah.
But one thing you're focusing on right now is letting people know, family members, friends of people who perhaps are depressed or dealing with suicidal thoughts, how they can step in and intervene, or how they can spot troublesome activities. What do you recommend?
Yeah, absolutely. So a lot of people are worried that if they're not a mental health professional, then suicide wouldn't be something that they should ask about. So we do frontline staff training programs or gatekeeper training programs so that anyone would know what to do if they encountered someone at risk for suicide.
Okay, and what do you recommend? Where do they start?
Yeah, so the VA's training program is called SAVE, which stands for Signs of Suicidal Thinking, asking the question, validating someone's experience, and encouraging them to get treatment. And so the first step is that someone would recognize a warning sign for suicide. It might be someone saying that things are hopeless, they're giving away valued possessions, they're getting their affairs in order, but there's something out of the ordinary for that person. Then the next step, the A, is for them to ask if that person is having thoughts of suicide. Some people are worried that if they ask about suicide, that would give the person the idea, but what it really does is it create a safe environment where they can share that they're having thoughts of hopelessness or feeling suicidal.
So not risky at all in bringing it up. Better to ask than to
Right, absolutely. Otherwise, it might set the stage that the person at risk for suicide thinks the person they're talking to is uncomfortable talking about suicide, or that they're projecting their own values onto that person. So yeah, absolutely appropriate to ask.
Okay.
Yeah.
Okay, very good. All right, we're going to take a quick break. I know I want to ask you about ASSIST and the Jackson County Suicide Prevention Coalition.
Yeah.
We'll talk about that when we come back. Stay with us. Welcome back to our 5 on 5. Again, we're talking with Suicide Prevention Coordinator Ben Bryan from the VA SORCC in White City. So, Ben, what about if people are trying to increase their skills in suicide prevention and in recognizing these things?
Yeah, probably one of the best trainings available is the ASSIST training, Applied Suicide Intervention Skills Training. It's a 16-hour experiential class where people learn the steps of literally talking someone off a bridge. And it's designed for people that aren't working as mental health professionals, that they would be the first person to encounter someone at risk for suicide. Friends, family members, church members, someone in the community. And so that would be a really good way for someone to get going to increase their skills in suicide prevention.
Okay, and how available are those classes? Are they do they have a fee, or is there are they taught often?
Yeah, they're offered every quarter, and the Jackson County Suicide Prevention Coalition puts them on. And so going to their website is the best way to access that. I think that they're $60 for the 2-day training, and part of that is funded by a grant. The trainings are normally $250.
Okay, certainly some skills people don't want to necessarily use, but got to have them, especially these days, a lot of people dealing with a lot of problems.
Absolutely, yeah.
All right, so do you have any numbers or suggestions for people if they encounter, if they don't have these skills, if they encounter a situation where they want to reach out to for professional help? What should they do?
So the National Suicide Prevention Lifeline is 1-800-273-TALK or 8255, and that's a good resource. It's available 24 hours a day. You always get a live person. If you press 1 when you call that number, you'll get directed to the Veterans Crisis Line or the Department of Defense Crisis Line. And then locally, contacting Jackson County Mental Health's Crisis Line at 774-8201 is a resource that's here in this community. Okay. So both those would be appropriate.
Okay, yeah, and as we're talking about, it's important to, if nothing else from this interview, it's important to reach out and ask people. Don't be afraid to ask these types of difficult questions.
Yeah, absolutely. And these resources, it could be that the person at risk for suicide calls them, but we know that people that need help don't always ask for it at the right time. So friends or family members can use these resources because they're worried about someone else too. Very good. Better to ask than to do nothing. Yeah, absolutely. Ben, good to see you. All right, thank you. Appreciate it. Yeah. Stay with us. We'll be right back.